It is the 4th of July Eve, and many holiday festivities are already underway. There's a good chance fireworks are in your 4th plans, or maybe the beach is more your speed. Here's a live look from Carolina Beach right now. No matter how you are spending the holiday, you want it to be fun and you want it to be safe. So whether it's fireworks or grilling out or swimming, Dr. Philip Lamptey, Cone Health Urgent Care Medical Director, is here to make sure that you do it and you do it safely. All right, let's first and foremost, let's start with the fireworks. Let's just kind of talk about, I know you've probably seen a lot in your practice when it comes to injuries that can happen, especially with the fireworks that are done at home.
Yes, the fireworks, I typically tell people that leave it to the professionals. If you decide to do it at home, you have to make sure that you're doing it in a very open area away from buildings. And also when you're doing it, protect yourself. Eyewear is important. Knowing how to work the fireworks is important. And then for your children, keep them away from the fireworks. If it's a community fireworks, make sure that you're at least a couple of hundred feet away, because loud sounds could cause permanent damage if you're too close to the fireworks. And then burns as well is one of the things that you have to be mindful if you are doing it at home. For the kids, give them flags to wave instead of sparks, because the sparks can get very hot, up to 2000 Fahrenheit. So those are some of the things that I advise my patients who are coming to see us relative to some of these events.
All right, so eye protection, if you're going to be doing it at home, let the kids hold flags instead of the sparklers and that kind of thing. All right.
Yes.
So if someone, though, does get injured, when should they be seeking medical care and from where?
So with burns, I would say that if the skin is not broken, you could use a lot of the stuff we find in the stores, like aloe vera creams and other burn creams in the stores. If there is blisters, please don't break the blisters. Just put the aloe vera over that. And if the skin is broken, you should always reach out to a healthcare professional. And you could do that for the Cone Web website. You can do that from the website. Do virtual visits, and you could also look for any of the urgent cares that is in town and make an appointment and come in to see us, or just walk into the urgent care.
Okay, that was going to be my follow-up question, is when do we know we need to go to the urgent care? I think so often we just think to ourselves, you know what, we'll just take care of it at home and we'll do what we can, but when is it that we need to go?
If your skin is broken from a burn, you need to get a health professional to look at it. If you have eye injury, those are things that need to be seen by a healthcare professional so that they will evaluate it to make sure that you don't need further treatment, and then make further recommendations from there.
Okay. All right. So that's the fireworks part. Let's go to the other part, which is 4th of July, which is the food. That is a big part of the holiday for sure. There's going to be lots of picnics and people are going to be out, and it's going to be 90-something degrees. Which means that we could easily get sick because something has been left out too long. So what is the rule of thumb there of how long we can leave some food out?
If you leave food in your car and the car heats up on a very hot day like we had yesterday and it's above 90 degrees, the food that comes out should be refrigerated within an hour if you have leftovers that you bring home. If you're grilling, make sure that the internal temperature of the food is as recommended, above 145 for meat product, and then above 165 for chicken product. So make sure it's well cooked. The leftovers are also another source of food poisoning. If you're grilling and you're done eating, make sure that you put it in the refrigerator within 2 hours after eating, and make sure the refrigerator is less than 40 degrees Fahrenheit.
And all right, he mentioned the degrees that it should be cooked at. He didn't say make sure there's no pink in the middle. So you actually have to use a meat thermometer to know whether or not you're grilling it to the right temperature or not. All right, so at what point would someone say, okay, I do have food poisoning, what should I do?
So if you are having vomiting that's not stopping, you have diarrhea with fever of 102 Fahrenheit or more, if you have bloody diarrhea, or if you start getting dizzy because you've had a lot of diarrhea and your blood pressure is not holding, or you're getting very dehydrated, those are the times that you need to come to be seen by a health professional. And again, you can go through the Cone website, conehealth.com/appointments, or look for the virtual options or the urgent cares to be directed as to what to do
You know,
next.
I wonder with that, especially like if you have a family member who's sick and is constantly throwing up, is that something that could be treated virtual care, or do they actually need to go to the ER or urgent care?
If they are throwing up constantly and they cannot keep fluids down, then that is one that they have to have a face-to-face visit with a provider.
Okay, that is good to know. All right, we're going to take a quick break. We're going to continue on making sure that you're safe on this July 4th holiday with Cone Health. We'll be back in just a minute. Welcome back. Dr. Philip Lamptey, Cone Health Urgent Care Medical Director, is here to make sure that you're having fun this summer and especially the 4th of July holiday, but that it is also safe as well. All right, so we're going to talk grilling again. Very popular, of course, during the summer. What are some grilling safety recommendations that we all need to know to avoid the injuries?
I'll say keep a fire extinguisher close by when you're grilling. Create a kids-free zone around the grill so the kids don't run into the grill. And before you start grilling, just inspect the grill to make sure that we don't have any wire bristles on the grill. People usually use that to clean the grill because that could present as a choking hazard for folks.
Yeah, we just had a chef on here and he said, use an onion instead. Then there's no bristles. You're good. Okay, let's talk about water safety. And this applies to kids and adults, even those who don't know how to swim.
Yes, I think, summer is a great time. It's good to be outdoors. It's good for the kids to be active. So learn how to swim if you don't know how to swim. And even if you know how to swim, it's always good to get a refresher so that you feel very comfortable and confident staying in the pool. The water safety is very important, and some of the things that you will help everybody stay safe is having an enclosure around the pool, making sure that if kids or anybody swimming in the pool, there's a designated watcher by the pool. So in case anybody runs into problems, we can identify quickly and then get the person out. Dress the children in colors that contrast very differently from what water looks like. So bright colors like you see on the screen to your left are important. And then the ones on the right could sometimes make it difficult to identify a kid who's in trouble or an adult who's in trouble. Life jackets are always helpful to use, and learning CPR can come in handy if anyone runs into problems. Also, if you have a child at a party or a family gathering who's missing, the first place you have to look for the child is the pool, because time is important if a child or an adult is in trouble in the water.
All right, and I think a lot of people think, well, it's already July 4th. It's too late for me to brush up on my swimming skills or even to learn how to swim. And you say never too late.
No, it's not. And I think there are a lot of resources in the community that you can access those kind of skills or get training regarding swimming. One of it we have in Cone Health is the Sage Well. You could access that. You can learn more about that from our website, conehealth.com/sagewell. And they have swim lessons for kids all the way through adults. So it's one of the things that I think of it as a safety issue. Knowing how to swim is a safety issue. So please, keep that in mind. The summer is here, July 4th this year. Stay active, enjoy yourself, and then have a happy 4th.
All right, we have just a little bit over a minute. I just didn't want to avoid this. Heat-related injuries, because it is so hot out there. What should we do if someone gets overheated?
The person needs to get out of the sun if they're in the direct sun, get to a place where it's cool. You can have this misty place and then get fluids in. Those are the kind of things that will cool you down so that you don't get overheated. If the person is overheated and they start getting confused, or they to seek help from a health professional to make sure that they don't need further care.
All right, we were having a few internet problems there at the end, but I think we got all of the good things that we needed to know out. Thank you so much, Doctor, for your time. If you missed any of this today, you can head over to our website and click in the To Your Wellbeing section.